Well, hello, hello. Thank you, everyone who is going to be joining live today, as well as watching the recording of Membership Medicine Made Simple, 5 principles to get started with your membership-based practice. Today, I'm excited to welcome Dr. Angela Andrews to our live stream. Dr. Angela is very, very awesome woman. If you haven't met her yet, I would definitely recommend connecting with her, LinkedIn, social media. She's a great follow, brings a ton of
Oh,
energy to everything that she does, and someone that I'm glad that's here with us today. Um,
thank
Welcome,
you for
Dr. Angela.
having me. I'm so excited to be with you today and glad that we've been able to connect. It's been awesome.
Absolutely. Well, just a quick background on Dr. Angela. She is the owner of not one, but 2 direct primary care practices, which is amazing. Also, something to think about if you are looking to expand your practice, different models or ways to go about that in the future. There are direct primary care practices out there that are looking to retire, to sell off, to, get rid of their business in that way, shape, or form. So, someone that you can tap into. That's not going to be the focus of today. Today, we're focused a little bit more on, hey, what are some of the principles and the reasons why you want to start a membership-based practice. So before we jump into that, would like to just invite you to introduce yourself, Dr. Angela, share your story a little bit,
Mhm.
and we'll jump in.
Yeah, so my name is Dr. Angela. I am an internal medicine and pediatrics primarily trained physician, do outpatient primary care. I'm also lifestyle medicine trained. And I started my practice in medicine 10 years ago. So graduated residency around 20 something, 2016. And I worked in the system for all of my initial career before starting my direct primary care practice. I knew about lifestyle medicine while I was in residency. Was really excited about that because it seemed to answer all the questions and address all the things that I thought were necessary in order to do primary care and preventive medicine well. But was quickly realized once I got into the system and as time went on, and the curtain pulled away, that it wasn't possible to practice medicine that way practically in a traditional primary care model. And I was looking for ways, searching how can I do this and still remain in integrity, also still be, financially viable, still have my love for medicine because it was starting to quickly wane, as a lot of practitioners are probably familiar with. So enter direct primary care. So I heard about the direct primary care model at least a couple years before I started my practice. And my primary direct primary care practice I started in 2024. And that was after lots and lots of deliberation. And it really, at the end of the day, became what I saw the only way to sustainably operate and practice medicine the way that was in integrity with how I wanted to do it. So that's where I am today. And that's how I got to where I am now.
Amazing. And you are going to be reopening your new practice here in December. So tell us a little bit about that kind of transition to
Yes.
bring on a second practice.
Yeah, so that when I was entering into the direct primary care community, first of all, it was an extremely supportive community, and we'll talk a little bit more about that. I met with several of the providers in my community and picked their brains, talked with them, and they kind of guided me along this journey and encouraged me. And one of the doctors that I was working with actually offered me space in her practice when I was ready to start. Well, I was not aware at the time that she was also looking to retire and move away from practicing. She had been doing it for 8 or 9 years and had one of the first direct primary care practices in West Michigan. So when time came that I was ready to move on into my own space and kind of branch my, spread my wings and fly, she said, "Well, I'm also looking to retire." So I bought her practice. So I own my original practice and her practice. And because of its longevity and its history in the community, I am actually going to be relaunching that practice as the direct primary care of West Michigan, effective December 1st of this year.
It's amazing. Congratulations. And that's such a fun story to think through. And again, like it just opens up the possibilities for folks who might be listening to, hey, there are so many different ways to go about this, right? And to see your success
Yes.
is awesome. Well,
Hmm.
great. Today we are diving into membership medicine. And again, as you mentioned, you lifestyle medicine is the core of what you do. And um, with the ACLM coming around next month in Dallas, we thought this would be a good time to maybe educate
Hmm.
folks who run a fee for service or a cash-based um, lifestyle medicine practice about why direct primary care, what the benefits are, why we're doing this, and some principles to think about as they get started to launch their practice. So at a high level, we're going to touch on these 5 topics. We have, making sure it's a patient's first experience, and that's part of the reason why you do it. being able to drive sustainable revenue from your practice, thinking about operational simplicity and making your life a whole lot simpler, the scope of
Mhm.
practice and the clinical freedom that you have to operate the practice, and then the community and support that comes along with the direct primary care industry. So we're going to spend some time just dive into each one of those in particular and understand what it means to you, how you think about
Mhm.
those items, and share it with the folks who are joined today.
Awesome. Let's get into it.
Cool. So to kick things off, a patient first practice. Tell me what that means to you and why, how maybe that varies or changes from the traditional way of things that you ran in the past.
So my practice, the things that I do in my practice are entirely determined based on what my patient needs are and how I can serve them better. When I was working in the fee for service, it came down to metrics and what the hospital system or what the payers were determining our values or our metrics were. So a lot of people are familiar with, all the metrics that we'd have to check off. And so a significant amount of our time and energy in the practice and for all of the support staff was put into making sure we were meeting those targets. But that was so far removed from what each one of the patients actually needed.
Mhm.
So not only do I not have to focus energy on those things, I can actually take the time to actually get to know my patient. So in order to understand their needs, you have to have time to listen. And when I was in residency, I had a colleague or now colleague, but a mentor at that time tell me that if you listen to a patient long enough, you'll understand what the problem is, what their needs are. So in my practice, I can be patient first because I actually have time to listen. And that is honestly one of the biggest things people tell me that they are so grateful for when they join the practice is the fact that there's someone who is a physician who has this understanding who actually takes the time to listen to them and care. And so that's like the most important factor in the patient first piece of it. You can't really make a difference in their life if you don't know what's going on.
Absolutely. It's so true. And it's interesting how you mentioned that in residency and likely in med school, right? You have time to think through problems and listen to what they're saying and experience medicine the way that you were hoping you'd be able to practice it. And as you get into the system, sometimes it gets driven away, right? The bottom line becomes
Right.
important. So it's being able to come back to this patient first experience and ensuring that you have time, you're there for them, and that's the reason why they're there for your practice. So beautiful.
Right.
Um, the second principle is really around sustainable revenue. And so, obviously, in the direct primary care model, it's a membership based approach to things. Talk to me about how that influenced your decision to start your first DPC practice and how people might think about that as they're considering a transition.
Yeah, when I was considering starting a practice, first of all, I had no ambitions of being an entrepreneur or a practice owner. That was one of the furthest things from my mind. And if it wasn't for the direct care model, I it's very unlikely that I would have ever done this because it was way too confusing. Like how do you get payers and you have to negotiate all these contracts and just a whole lot of extra stuff. And so essentially very overwhelming. With the direct care model, the fact that it's just a membership, it's just very clean and it's very straightforward. The simplicity of the revenue piece of it also simplifies the whole patient relationship because it's not being driven by how much money can I suck out of patients. It's like, okay, this is our agreed upon, rates, and we can just focus exclusively on care. So because I mean, there's some other factors we have in there too, but basically I know where all my money is coming from every month, that membership, and that's strictly dictated by the number of patients. That's it. And you can get more complicated as time goes, but that's really all you need at a basic level.
Exactly. I love it. One of the questions I see this kind of popping up, Roman, Sarah. I think we're gonna probably defer these two questions for a little bit. These are great questions, and it's we'll open up a Q&A at the end. Sorry, I didn't mention that at the beginning, but as we're going through these kind of high level topics, we'll discuss things that kind of hit on those, and then we'll push out the other questions to the end. So thinking about the third bullet, if you will, or the third kind of principle to think through, which we call operational simplicity. How has shifting to a direct care model enabled simplicity in your practice and kind of the way that you're able to run your practice? As you mentioned, you thought practice ownership and management was so far out of reach because there's so much that went into it, but it sounds like
Mhm.
that fits with direct primary care, right?
Yes, and so don't get me wrong, there is a lot to do and it is very busy, but it is in a totally different kind of rewarding way. I mean, you're still not a business owner, you still have to manage your income statements. So all that stuff happens, But again, everything is much more simple because the finances are straightforward. When I started my practice, it was just me, and I was able to pay the woman that I was renting space from a little bit extra to use her assistant, but it was just really straightforward. I paid for my EMR, I paid for the space I was renting, I had my supplies, my computer, just really straightforward. So it was really clean that way. There's also what labs and interacting with other vendors because patients are going to have to get things like that done. There's very simple options. It's very clear what things are going to cost people because when I negotiate a rate or have a negotiated rate with a lab company, I know what that's going to cost patients as well. So it's just there's no hidden cost for me and there's no hidden cost for the patients. It's very straightforward. The other thing is there's not a lot of hierarchy. I have an clinic manager now. She started off as an assistant and then medical assistant. Now I've promoted her to clinic manager, and it's pretty much just her and I. I'm bringing on someone full time to do more operations as we grow, so I can
Mhm.
move some of those things off of my plate. But now between her and I, everything that happens in the clinic is between the two of us, and we can afford to keep things small. And my intention is still to maintain that intimacy because the practice size is small. I have about 200 patients right now. My goal was only about 250 patients. And I'm actually going to be bringing on another doctor in January. So that's really exciting um, because of how small the practice is and how simple the flow of resources is. You just don't need a lot. There's not a lot that transpires in the practice that neither her or I know about. So it's really beautiful, and also the patients feel it. They come in, they're not confused about who they need to talk to. They know both of us. It just feels like a family.
I love that. Absolutely. In terms of, I think that actually plays well. You talk about operational simplicity, the back end, the business side of what you do, and then transition so simply into the scope of your practice, right? Because so much of how
Right.
you practice and what your clinical freedom that you enable is tied to what the business is as a whole. So, do you want to share a little bit more about what the scope of your practice is, what clinical freedom
Mhm.
means to you, and how that's kind of maybe changed over time?
Sure. When I started off, I was doing a lot of really traditional primary care things, vital signs, going over your chronic conditions, talking about exercise and diet, educating people about how to eat foods and, bringing in some of those lifestyle principles. Well, then I started thinking, well, I would really like to have like ability to do body composition. I would really like to offer some webinars around how to make certain meals. I love to have a newsletter where I feature a new meal or a new healthy option every month. I would love to have blogs where I can highlight topics that come up in our sessions that are really lifestyle focused and so on and so on. And I don't have to get permission. I do it because it makes sense.
Exactly, right. And it allows you to serve your local community and what their needs are, right? And I think that's
Right.
one of the biggest things as a DPC member here in Santa Cruz. My doctor knows our community here in Santa Cruz and understands what's important to them and is able to
Hmm.
provide the care and the direction that's based on what the needs of the locations are, right? And when you get into some of these large
Right.
systems that are multi-regional, multi-state, internet, whatever it may be, they can lose focus of that. Hey,
They
what?
lose that. And it's not even just the facilities themselves. When I was a medical student in West Michigan, and then I came to practice in West Michigan. So I'd had lots of years of exposure in the medical community. I didn't really understand and know how to navigate the medical community and the resources in the community until I was on my own.
Yeah.
Because up until that point, I was buffered from it and not in a good way, in my opinion. So now I also understand where are the best places that my patients can get discounted prices, whether it's labs, imaging, who are the providers that are willing to offer discounted cash prices for things like orthopedics, or where can they get an IV fluid? How can they avoid going to the ER for some things that they would normally go to the ER for, even if they're insured? These are all things I didn't know the answers to, but I do now because I'm more tied to the community. I interact. And before I didn't have time to go to other people's offices and meet with some of the specialists. I mean, I'll go meet with them, not because I want to have lunch,
Yeah.
because chances are they're going to give me something I don't want to eat anyway, but because I want to get a feel for what is it like when you walk in here? How are you greeting your patient? So like, I mean, I take that very seriously. If I'm sending my patient from referring them somewhere, that reflects on me. When I was in the system, I didn't know most of the people I was referring to. Well, now I know them much better than I did before. And then if we have walk with the doc, and I tried for a while to get that started when I was working in the system I was in, and it was very difficult. And
Mhm.
that was one of the first things I started when I opened my practice, one of the very first things.
That's amazing. I think that ties into our last point, which is building out your community and having that support system around direct primary care makes it so attainable. Can you talk a little bit about what the DPC community looks like for you, and then how you started to build out your local community in Western Michigan, Michigan, and launch Seeds of Health?
Yeah, so when I started my practice, or just before I started my practice, there were at least 3, maybe 4 other practices. A couple of those, one has relocated, one has closed doors, and many more have opened up. So now there are at least 3 additional practices and a couple that are preparing to launch. And so from a DPC networking standpoint, our community in West Michigan is thriving and growing. And we actually meet almost like at least quarterly. We actually have a meeting coming up in a couple weeks where we're going to get together and we just share best practices, questions, and or just lean on each other, maybe complain about, who we're having issues with in the system, that kind of thing. So that's been a really great support. And then outside of that, the DPC community at large is tremendously supportive. It's the most supportive community in medicine that I've honestly ever been a part of outside of my residency family. And I am so grateful just to be a part of that. It's incredibly motivating. I mean, it really just brings joy. Everyone that you're around is just happy and full of joy. It's like going to a conference when you're at a DPC conference where you're just like, oh my gosh, you guys are all happy.
Yeah, yeah,
Like it's fantastic.
yeah.
So it's wonderful.
They end up being a celebration of how the industry should be, right? And how you can get people
Yes.
blown away and be really proud of that as well, which is awesome. Cool. I'm not sure. I saw Dr. Jamie Baines comment. Have you met her before?
No, I don't think so.
She's a Michigan. Where do you go? Michiganite? What's the term?
Michigander.
Michigander. Perfect. Yep. She's awesome.
Yep.
I believe the two of you would hit it off. But yeah, cool. Well, I think that kind of ties up, the principles. If there's any lasting kind of recommendation, feedback, insights, like, hey, if someone's on the edge of, do I go this route? What would you recommend? How would you sell them effectively?
Well, first of all, if you've seen one DPC practice, you've seen one DPC practice, and that's a statement that if you haven't heard it, you'll hear it time and time again. So I would recommend seeing multiple DPC practices. So if you're considering opening, look at practices in your community. There's also great networking opportunities for people who are considering or DPC curious, if you will.
Mhm.
Boot camps. I encourage you to take advantage of all those resources, get involved early, so you can start. There's a lot of the things you have questions for have already been answered. So you don't have to reinvent the wheel. And as far as so there's things that are broadly, defined, but then you're going to really want to know if there's people in your community who have already done it, what have they figured out, so that you're not trying to recreate things. And even if there isn't anyone in your community, there's someone in a community like yours you can connect to. And I remember picking up the phone and just cold calling DPC practices in other places that were doing lifestyle medicine. I look on the web, look on the web and say, oh look, they do lifestyle medicine. Let me give them a call. And literally answer the phone. One woman answered the phone at 9 o'clock at night. I thought I was going to get a voicemail. And she's like, no, I'm answering the phone. I was like, I'm so sorry. And so some of those phone calls with random people that I didn't know gave me some great ideas that I incorporated in my practice right away. So my advice is don't be shy, ask questions, meet people, and do that before you jump in. And once you do that, you'll be incredibly excited and you'll get some great ideas.
Exactly. Well, I'd be remiss before we jump in the Q&A to not mention a few things. So first of all, Dr. Angela, you are going to be attending ACLM next month in Dallas. The Hint team
Yes.
will also be there. So if you are watching this and you're going to be at the event, look up Dr. Angela, swing by the Hint booth, say hi to everyone. Some of the things that Hint does that's really, really cool that you just kind of touched on are those boot camps. We have a whole
Mhm.
community that's built on the Hint platform. So as a customer of Hint, you have access to all of these different clinicians who have done this before, who are going through the process. You can join a boot camp and go from 0 to 1, be able to launch your practice. It's a 12-week free boot camp that you can join, that gives you all of the information that you might need to launch the business side of things. I know business can be scary. So wanted to just share those potential resources as well. And then every year we at Hint also throw a Hint Summit. Hint Summit is the biggest DPC celebration that there is. This year we're taking it out to Nashville, Tennessee, which is going to be awesome. This is the furthest east
Mhm.
we've gone, and we're really excited to welcome so many of our customers and DPC curious folks who might want to check it out. So it's going to be Nashville, Tennessee. It's going to be April 8th through 11th. And in addition to that, there's a ton of great content. There'll be more stuff coming out around that. So just kind of be aware of that. Now, we have a few minutes for questions and really happy to dive into those with folks. So these might get a
Mhm.
little bit technical, not necessarily solutions based, but let's just see what we can do to help people out.
Mhm.
So first of all, we'll start with some of the labs and images size thing. Maybe just as kind of answering like how are you building labs and imaging into your practices today?
So I use Quest Diagnostics primarily right now, and the best way to get your prices, you really want to be a part of what's that called, a purchase group,
Mhm.
and you can join a purchase group through a lot of different ways. So we have a regional one over here on the side of the state in Michigan I'm in. If you're a part of, like, for instance, the DPC Alliance and certain DPC organizations, you can be a part of a purchase group, and so you're going to want to start there, and then you can join or get an account with one of the lab providers through that, and you'll be guaranteed those rates.
Yep. And with Hint Clinical, you have ERX, e-prescriptioning through that. So once you sign up, you're good to go. Definitely worth looking at. From what I understand, like sign up for a GPO is what, 10 minutes? It's very, very quick. You get
Very
it.
quick,
Yeah.
very quick. Yep. And then
Done one.
imaging, I don't know if it works quite the same for my imaging. We have like a couple different regional imaging centers, and they just have direct cash pricing. So for that, you can usually get rates. There's usually often, hopefully, facilities that already offer discount prices, or you can get pricing directly from the big hospitals in town as well.
Yeah. And Roman, I'll also shout out one of the Hint partners that exists. They're called Green Imaging. They've been around for a very long time supporting the direct care industry, and they're a mobile imaging group. They're all over the nation. So definitely check them out, see if there's anything
Ooh,
really, really cool business and partner.
nice.
Let's see here. So next question, Roman, we plan to combine DPC with functional medicine. Do you have any advice on how to draw the line for in-depth testing and consults?
Oh,
Plan wise, fee wise.
oh my gosh, I have been treading this water now for like the last 6 months to a year. I would highly recommend, first of all, drawing a line between those two. And I think, my one advice would be maybe to have two different membership offerings. Maybe you can have a basic tier that provides routine primary care, and then you can have a higher level tier. I mean, that's just one way to do it. You can have, like, pricing, like, market pricing. I mean, honestly, there's no one way to do it. When I was exploring it, I was looking at two different tiered approaches, and that might be what I end up doing. I obviously have been dabbling in functional medicine. I will say that my malpractice people in Michigan do not look very fondly on functional medicine, so that's also been a factor. So consider your malpractice as you're approaching that, and make sure that the people that are providing that are not going to give you too many issues before you go down that route, first of all. And then the other way is look at how other people have done it and then decide what works best for you. And my other advice is try it, and if it doesn't work, change it.
Couldn't agree more. Roman, I'm gonna actually also point you in the direction of one Hint customer who I think is doing a really good job of this. They've grown their practice. They've added on a bunch of services. They're called Practical Healing Center. They're based out in like Wadsworth near Ohio. And so I'll just drop the link there. They are transparent with the pricing. Great people. I know Logan and Sarah would
Awesome.
be happy. Again, this is the part of the DPC community thing. Logan and Sarah would be happy to take your call anytime and just talk about what they're building and how they went about it. So lean on the community. These events are great, but get into the Hint community and ask questions. People will share what they know.
And ask as many people as you can, honestly.
Yeah, absolutely. And then charging for membership. I think we, as part of the boot camp, we have an entire day, dedicated towards what is the price? What should you be charging? How do you go about it? Dr. Angela, do you want to share just what your kind of process was for that?
Yeah. So I actually so I'm an engineer by training. I created a spreadsheet, and I put at the time all the prices by age, and I put just a whole lot of details in there, and I did some data analysis. And so I looked at what was being charged in my area for this comparable services. And I basically, I put myself like just near the top. And so I mean, it wasn't anything crazy scientific. I went what was happening in my location. I think a lot of times pricing is often dictated by where you are and what people are willing to pay. For me, it was important that I distinguish myself from concierge medicine. So I wanted to make sure I stayed below that. So I also wanted to see what were the lowest concierge people charging. So I kind of like priced myself somewhere in between there.
Got it. Perfect. No, I think that's a good model to go about it. Depending on where you're at and who your customer is going to be, I think that's a really important aspect of things as well. So, at Hint, one of the things that we're a big proponent of is you get in there, you get what we call your retail memberships, organized, set up, launch, get into your practice and get all of the efficiencies structured in the first 6 months, first year or so. And then at that point, if you're interested in kind of growing, that's where you can look at working with employers. And so how things are priced for employers or how you work with employers and brokers and things like that can vary as well what the prices will be. So we have tons of content that we can share with you on the Hint website, blogs, live streams, things like that, as well if you have any questions around how you go about it. Yeah, Dr. Angela, do you work with any employers today? From
So
Dustin.
I don't work with any employers directly in my practice. I have some connections through Hint Connect. And I actually I was one of those practices where I was like, wasn't sure I wanted to go down the employer route. I'm more open to that right now. I'm such a like really personal relationship driven kind of practice, like, hugs and get together and all. I mean, so like it just didn't really fit my personality.
Yeah.
So I've kind of shied away from it.
Yeah, and you mentioned, your goal is what, 200, 250 members. And so, at that you can
Yes.
really be very specific in who you want to draw in
Yes.
your practice, who you want to be
Yes.
spending your time with, right? And so,
And that was intentional. I wanted to be very spin like there's a characteristic and I don't even need to seek those people out. They find me. And
yep.
they're usually people who are really committed to making change. I want to help people who really struggled and may have a lot of health issues, but are also motivated to be involved in the process. And that's not every patient. So those people come to me and I love working with those people. So that's really been the heart of my practice. Plus I like to leave time. I can't have too large of a practice because I have this whole other side of things that I do between podcasting and speaking engagements. And so these are all things I want to leave time for so I can also share what I know with larger audiences.
Yep, absolutely. And Roman, again, there are a lot of employers who are loving work. I mean, a lot of DPCs and employers, DBs that are loving working with employers and employers loving working with DPCs. We have case studies that we can point you to on the website, as well as if you're looking for introductions to brokers or advisors or people who might be wanting to work with the DBC. That's something we get support in. And if you haven't already joined Hint Connect, it's a
Mhm.
free direct primary care network that you can join. And as Dr. Angela mentioned, if we have lives that come to your area, we can assign them over to your practice, and it's a way to just kind of
Yeah.
over time trickle. I call it the trickle charge of just
And I
adding
and I
lives.
joined that before I was a part of Hint too. I was with my other EMR and I was like, wow, I can join without, so that was really amazing. I will also say in our area, there's another practice that is a membership-based practice, and they are exclusively employer-based and they're doing wonderful. So it just comes down to who do you want to attract. And if you make that your market, you have to actually talk to your market. You have to make sure that you are putting yourself out there in a way that you're attracting those people
Yeah, I know we
or
did a live stream.
organizations.
We did a live stream maybe 2 months ago, and it was around kind of how you want to expand into employers. Like, how do you change maybe your branding, your persona? Like, what do you need to think about when you shift the conversation upstream to a CFO, to a head of HR, to a CEO of a small business, right? And so again, there's just
That's
so
a
much point.
totally different conversation and a totally
Exactly,
different brand. Yeah.
100%. Yeah, yeah, cool. Great. Well, again, Dr. Angela, thank you so much. Folks, if you're going to be attending ACLM or Hint Summit, please look up Dr. Angela, say hello to her. If you're on the edge, or if you have questions about, hey, should I do this or should I attend Hint, something, like, do it. Just jump and ask questions. We've got a thriving community that would love to answer those for you. So wanted to say thank you so much for spending some time with us today. I'm excited to see you again soon. And yeah, appreciate you.
Thanks. My pleasure.
All right. See ya.
Bye.